కనిపిస్తుంది. Okay, can you able to see the screen now?
Yeah.
So I'm trying to mapping this one or two variables so that you can know how we map it. Okay, so where is that? Okay, let's say for example. No, this is not the way. So you map like this, okay? The study ID, and you change your color. You can put a red color. Okay. So from your implementation guideline, so here you have study ID. Okay, so this one you mapping with this study. Okay, like that you do everything for the subject ID. Subject ID. So maybe you can write. But this is common for each domain, so you just put it like that. You don't need to be mentioned. Subject ID. So if you have a demographic raw data, which is a DM domain, so this is DM.
Ali?
Yes.
So yeah, this one, like now whatever we are doing, like dm.sex, that we do it, right?
Yes.
Who will do that? The one in green?
The CDM, the clinical data management, they do it.
Okay.
So we mostly work for SDTM atoms and the tables, right? So we are only as a programmer. So in the real time, so one programmer is dedicated to do this kind of work, you know, to creating this mapping this SDTM.
Okay.
So you have to map each and everything. Okay, so you go one by one and do for all those things. If you do one CRF, it's going to be each for all the subject will have the same CRF, right? So
Yeah.
each subject has one
So
CRF.
so basically, say suppose if we are doing phase 3 trials, and we'll have almost like how many thousand subjects, right?
Yeah.
So we so basically like we'll have 1,000 CRFs.
Yes, you will be have 1,000 CRF, but you do annotate only once, only
Okay.
one CRF.
Okay.
Because
Okay.
you're not going to do all those things, right? Because you will have the same information for all 1,000 patients.
But how do we get now? We don't do that part, right? Like say now we have thousands.
Data entry people, they do it. The data entry people, they already do everything.
Okay. Okay.
So, and the CDM people, they do their part of mapping, and
Okay.
you will get the raw data sets. Okay, you will get the raw data sets, and you will have 1,000 observations for particular raw data, and you just need to map it our own standard way. Standard, you're just doing the standardizing. Okay,
Okay.
so and you go to like each one by one, like site ID, subject ID, and you map with your SDTM variables. Like here is a visit. Okay, so I have visit ID. Maybe.
No, no, Ali. My question is like
Mm-hmm.
when already data sets are being created. I
Yes.
mean, this part what you're telling is only for our information or for
Yes.
for
For
interview purpose, right?
this is only we have to map it. We have to map it. Oh, okay. For example, if your raw data set has gen, okay,
Mm-hmm.
um, and you don't know what is gen is,
Okay.
then you have to go to the CRF and you know that gen is okay. It is gender related information. Okay,
Mm.
but however, the gen variable in the raw data set, which is not the standardized variable. So we need
So
to standardize in as SDTM. So we have
we
to
change
map it as
the we change the name of the variable then.
yes, as a sex,
Yeah.
which is the variable present in the SDTM dataset.
Yeah. Yeah. Okay.
So like that, we have to map it as a CRF. So they will, in nowadays, they will be the new kind of software, because I'm not doing the SDTM, I'm doing mostly TLF. So nowadays there is more kind of softwares there, Mint, MINT,
Mm-hmm.
which is with the software, it does automatic. If you included the SDTM implementation guidelines, and if you provide some information, they do automatically. So
Okay.
that kind of information I have it. But you can say in the interviews we have a software Mint. It does automation. Even the companies nowadays, the SDTM mapping also, everything they're doing like automation, and they're
Mm.
replacing the programmers, and they're more focusing on Adams and TLF, mostly because the Adam TLF they cannot able to do the automation things. Okay, so this is part of the annotations. If they ask you the annotation of the CRF, if you ask you what is the annotation, you have you done anything, and this is the thing. This is the you're just doing the annotation for the variables in the CRF. Okay, so like that, you will continue with all those things. Okay, so we have finished the control terminology, implementation guideline, SDTM, and the CRF, and the specification now, SDTM specification. So tomorrow we're gonna start doing the programming for the DM. Okay, so so you can see the screen, the Excel sheet. Mostly we use the Excel sheet in the real time also. Okay, so you can see the sheets in the on the bottom. So you have a DM, sub DM, EX, AE, the vital signs, LB data sets. So these are different ones. Okay. Okay, so here we have VSLB, which is efficacy data set, and AE. So there will be MH and the DM, all those things are safety data sets. And the supplementary data set subdomain. Okay. Okay, let's go with why it looks like this. Okay, let's go for EX. Okay, this is the specification. You can see all your variables are whatever the variables are present in the implementation guidelines. Okay, these variables. So if you are doing like 5 years of experience or 6 years of experience, they will ask you, have you created the specification for SDTM? And you would say like yes. And this is the specification you have to create. So you just copy all those variables, like you just copy like this. Okay. Not sure why it's not. So maybe you can change this one, the PDF, into the Word format. Then only you can get all those paste. But it's not getting here. So you get all those variables. You copy the whole variable for the EX and you paste it here. Okay. And the label part also the same thing. You copy all the labels and the type and the control terminology. So you copy all those things, the label, type, and the control terminology. And the core, which I mentioned, like required, permissible, the expected. You also get the information from the implementation guidelines. So the core, you copied that one and you paste it here. So here there are 3 columns extra. Okay. One is the length. So how much the length you're going to assign for the particular variable, it is all depends on you. Okay. If it is a numeric, and this is a general rule. Okay. If it is general rule, okay, for the numeric variables, the length is 8 characters. Okay. And for character variables, the length is max 200 characters. And right, for the numeric variables, how it represent if you have any missing values in the
Dot.
SAS data. Yeah, dot. And the characters.
Space.
Yeah, exactly. So it should have to be 200. It's up to you. You can see, you can put 100, you can 50, and it is user defined. Okay, there is no any kind of standards. You can do anything you want. But for the numeric, it always has to be 8. You can go less than 8, but not more than 8. Okay, that is a length column, and this control terminology you took it directly from the implementation guidelines. This part. Okay, you just copy it, paste it there. And the origin is the basically you're kind of giving like how you mapping, okay, how you get that information. Either you're getting from like protocol, how you get. So some of the variables you get from the protocol. Okay, so for example, study ID you can get from the CRF also, and the CRF also gets the study ID, but in the protocol also will be mentioned. So you have to check yourself where you get that information. Okay, now this one is assign. Okay, assign is basically you are assigning something, because ex is the domain. Okay, domain variable. So as per the control terminology, it always have to 2 characters, dm. Okay, so dm. If you go to the exposure data set, you will have ex. If you go to the concomitant medication, you will have cm. Okay, it always have to be 2 characters. That's why giving the length 2. Okay, and the other part is unique subject ID. This one has to be derived. It has to be combined of 3 variables: study ID, site ID, subject ID. But when we go to the programming, I'll explain how you derive the unique subject ID. Okay, so like that, the protocol, derive, assign. So if it is this information coming from ex close form coming from the CRF, you mentioned where is the origin. So you're coming from the CRF. Okay, and they will ask you in the interview how you what are the ways the processing for SDTM mapping. So you will explain this one. Okay, either I can use for the assign, the derive, splitting or derivations. So all those ones will be here. So I can go to check here. Yeah, for example. So explain the process of SDTM mapping. You can directly assign, you can rename it, you can standardize, you can derive, you are combining. So these are the some methods. You can explain those processes to them. Okay, so yeah, that is pretty much overview of the SDTM. So you won't go more than that one. So tomorrow we're gonna start the programming part. Okay. And do you have any doubts so far?
No,
Yeah, one more, sorry, one more column. This is the comment section. So the basically it gives the derivation how you derive. For example, unique subject ID, they will give what are the variables combined. Okay, those ones like set to 765 ex. Okay, so this one, when we go to the programming, I'll explain you. You can have better idea for that one. Okay, this is pretty much for the specifications. Once you're done this specification, when you're going to do the submission part, when you do the submission, always you have to include your specification, SDTM specification. So in the Pinnacle 21, the validation tool, you can do the specification there for validated specification. Okay, so that in the Pinnacle 21 part. But when you're creating the programming, when you're creating the data set, you only need this kind of specification. Okay. So what does it mean, this kind of specification? Basically, this is not validated. Okay, you're not supposed to send this one to the FDA. So you have to send submission validated specification by using the Pinnacle 21 only. You can have to submit for the FDA for the approval. Okay, so that's it for the SDTM, and we're gonna continue from tomorrow for the DM data sets. Okay, so do you have any doubts so far?
So SDTM specification also we do validation.
Yeah, we do validation when we're submitting for yeah, when we are submitting, like for example, you have to submit everything, the data, SDTM data sets, SDTM specification, ADAM data sets, ADAM specifications, even in between we have some other document, SDRG, reviewer guides, ADRG, those guides, those documents, and you will also have reports, all the reports. So for each study we'll have in average 200, like 100 to 200 reports. So sometimes you have listings, and sometimes you will have more on tables, sometimes we have more figures. So it depends on the project, how complex is it. So all those documents you attach in the module 5. Module 5. Okay. So this is the folder, and in ECTD. Okay. And common technical documents, because when you're submitting new drug applications, so they have different modules, right, for ECTD. So all your statistical information will be provided here in the module 5. And this is very important question also in the interview. They will ask you which module is going to your statistical things. Okay, you say module 5.
Okay. For every study, we need to include all the data sets, only
Yes.
particular data sets.
No, what do you mean particular data set?
So for findings, like we have how many data sets there?
No, for each therapeutic area, we'll have a different data set. For example, if you have DM is common for every study.
Yeah.
Okay, AE, VS, LB, these are the common data sets for every study. Questionnaire data sets. So sometimes what happen in the findings? Okay, let's go with the classification. Okay. So here you can see in the findings, general observations, you have many of them, many domains. Like for example, reproductive system finding, which is the therapeutic area for the reproductive system, the gynecologic therapeutic areas. You should have RP. Okay, the PK concentrations, like for example, immunogenicity, specimen assessments. These data sets should also have in the infectious disease in the vaccination data sets. So these are some common, depends on the therapeutic areas. So this IS, it won't be in the oncology. This IS data set, it won't be here because it is no use there in oncology. So they don't provide this data set.
So who will define these data sets to be included in the study? Or
well, in the protocol, they will mention in the protocol, even when you're getting the R data, you can easily identify it. For example, the tumor identification. The tumor means the cancer related studies, right? So this data set will be always be included in there.
Okay.
So in the protocol, they mention what are like if it is PK/PC, which is phase one related data sets. Okay. If you have a microbiological, these are some kind of the common therapeutical thing. If you have ECG, which is the cardiovascular studies. If you have a death details protocol, the deviations, these three, these are common for every study. Okay, the general observation class we call as, and it is common for every things. And the interventions, general observation, are also common for every study. And the subject visits, and these are also the common. So these three classifications are common for every study. Okay, when you come to the findings, there will be some data set will be there and some data set won't be there. It depends on the
study.
the protocol or study. Okay, yeah, even the vital signs will be there for every study.
What about the trial design, trials?
Oh yeah, the trial design, trial arms.
Those
So
also to be included, right?
yes,
Okay.
this has also been included because the trial arms, the trial elements, these are like review purpose, not for any kind of analysis. So these are the initial kind of data sets. Okay, so we will discuss these ones after. Okay, this is like how the data to divide it. For example, if the client will ask you to give the like overview of your clinical study, the basically you will submit these ones only. The trial arms, trial elements, these are the planned ones. Okay, the planned ones. These are not the actual data sets. So here you have inclusion exclusion criteria, right? So here also you have inclusion exclusion criteria somewhere. So
Ali, we do one thing before class tomorrow. We will discuss more about these arms, elements, epoch, and
Yeah,
period.
yeah, yeah.
Like at least 15 minutes before programming, so it will be good.
Yeah, yeah. I can explain for the tile arms
Or
because
theoretically, whatever.
yeah, this is arms is related to the treatment, elements related to the periods, inclusion, the visits. It's just, when you get the protocol and you just need to segregate. So what are the treatment? Okay, let's explain you here. Treatment arms. Okay, trial arms. Sorry. Trial arms. This is for, the trial design domains only for overview of your clinical study. Clinical study. Okay, when you get your protocol, okay, clinical protocol. So we have to divide it. We have to divide what are the treatments and what are the inclusion exclusion criteria. And what else? Yeah, visits and summary part. The clinical protocol is a theoretical one. Okay, this is developed by the biostatisticians and the physicians. All those. This is a theoretical. The protocol. Okay, this is a document. Based on the document, you do trial arms. Okay, trial arms. The name itself, the trial, which is a planned one, is not actual one. So when you finish your clinical trials, whatever the data you get, that is the actual ones. Okay, this is represent this protocol. There's nothing much complication with the trial design domains. We just divided what are the in the protocol, what are the visits you mentioned here, what are the arms you mentioned here, what are the inclusion exclusion you mentioned here. So the just for review purpose only, this is not considered for any kind of analysis. Okay, so that represent purpose only, they will create the initial, and this is the initial data sets we create. Okay, for every project, when you get new project, we create based on the protocol. Because the client wants to see the protocol, because the client, they don't know the protocol what exactly it's about. So trial design elements. So what are the elements? Basically, you are dividing the protocol in different ways. That's what it is. Yes, Pala.
So there will be very less number of records maybe in this.
No, there is no records at all. There is no study. How do you say the subjects? There is no nothing. You're just giving that information. Okay, you're just having some information in this domains. In the trial arms, you will be having information of the planned arms. Okay, the planned arms and the actual arms are different. So here is arm means the treatment. Okay,
treatment group or treatment.
Treatment. The arms they call as treatment. The treatment like the drugs. How you treatment. So we have a planned arm and actual arm. So in the protocol, so when you're writing the protocol, okay, for one subject you're going to give drug A, and other subject you're going to give drug B. Okay, but in actual scenario, let's say for example, patient 1, you're giving the drug A, patient 2, you're giving the drug B. Okay, that is the plan. You plan that one like that in the protocol. But sometimes what happens, due to some deviation, it changes. Okay, so the patient 1 will receive drug B and patient 2 will receive drug A. That information we need it. So this one is just representing in the protocol. Okay, those information here will be represented here. The actual arm we considering for analysis. Okay, and we will write the protocol deviation. There is a deviation data set here. There, all the protocol deviations will be considered here. So to be short, all the clinical things, whatever you do, will be recorded in the data sets. Okay, that is you're not going to miss any information. You should also have to include everything. Even if you have any kind of medication, the patient took any kind of medication for adverse event, it has to be included in the concomitant medication. And if you're using alcohol, is taking any alcohol, is taking cigarettes, so those information will be get here in the substance use. Okay, and if the patient is going any kind of surgeries, so those procedure will be mentioned here. So all the information will be included, whoever in the study trials. Okay, I'm gonna stop it here. We're gonna continue from tomorrow. So just to be finished.
Okay.
So if you have any doubt, just let me know. Okay, so I'll post it the control terminology, the specification, SDTM specification, and the CR, the copy to your email, and we can discuss from there.
Okay.
Okay, Marathi, you clear, right, Marathi?
Yes.
Okay, I'll see you tomorrow then, huh?
Yeah.
Okay. Thank you.
Okay, Bala, thank you.